part of the presentation symposium, we have what we call the Cassiopeia study. The Cassiopeia study will be presented today by Dr. Moreau. And so this is basically a Daratumumab study for transplant-eligible patients. So the study investigated VTD versus VTD in combination with Daratumumab for the younger transplant-eligible patients. So Dr. Moreau will report on the first part of the study, so VTD for induction and consolidation. Then the study has a second part, so we have after consolidation, patients will be have been randomly allocated to either Daratumumab maintenance or observation, but this part will not be reported and will need a longer follow-up. But still, looking at the first part, this Daratumumab VTD regimen was extremely effective in terms of response. Most importantly, the primary endpoint was stringent complete response. And this was significantly better for those patients who received Daratumumab VTD. MRD assessment was done, and it was also significantly better. If you look at PFS, the 18-month PFS is 93% for DVTD versus 85% for VTD, so a great improvement. And of course, this is not mature for survival, but survival is expected to be very good at the time of the final analysis. So this is currently this is likely the most effective Daratumumab regimen in the frontline setting for the transplant-eligible patients. And so this is a great study which was part of ASCO, which is part of EHA, and which has been published in the Lancet a few days ago as well. We got updates on other CD38 studies, and for example, the Daratumumab, lenalidomide, and dexamethasone MAIA study in the elderly has been updated got new analysis, especially the new analysis for the very elderly, what we call the age analysis. So the good news is that DRD is a very good regimen also for the very elderly patients, so patients 75 to 90, let's say. So the hazard ratio for PFS is 0.63, which is a great difference. So median PFS for DRD has not been reached. It's approximately around 30 months for the lenalidomide and dexamethasone arm. So this is important from a clinical point of view. We got also the COLUMBA study, which is the Dara subQ phase 3 study. And so Dara subQ is as effective as Dara IV, basically, with a better safety profile in terms of infusion reactions. So this is significantly better, so infusion reactions going down to around 10% versus 30% for the IV. So this will be a great improvement as well, and so this just means that in few years we will have subQ Dara for the vast majority of patients, I would say. We got another CD38 study, but with isatuximab. This is what we call the Icaria study, pomalidomide dexamethasone versus pomalidomide dexamethasone on isatuximab for patients having received at least 2 prior lines of therapy, including a PI and an IMiD. And so the study met its primary endpoint of PFS, so the median PFS for pomalidomide dex and isatuximab is about 1 year, and it is approximately 6 months for the pom dex. So that's a great improvement in terms of PFS, and this will likely lead to an additional POMDEX-based approved regimens in the near future. So I would say a lot of good studies, and probably the VTD Dara is likely the most important one for the clinical practice. So that this is a registration study. So that also means that Dara VTD has already been approved in one country. So Brazil already approved the Dara VTD, but that will be a kind of global standard of care in the future. So okay, some good studies, and also we are looking forward for next IMW and next ASH for new updates on new studies as well.